Hey, you guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I have been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success, and I would love to assist you if needed. But y'all know I like to get into my disclaimer and reminder before getting started because there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here are designed by me based on the current guidelines that are currently being tested on the ANCC as well as AAMP exam. Now, any of my videos that I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into our questions for today. Question number one states, a patient presents to the office with complaints of excruciating pain to his left great toe. Upon examination, the nurse practitioner notes swelling to the left great toe. The nurse practitioner is thinking gout as a differential diagnosis and wants to obtain labs to confirm this diagnosis. What lab should the nurse practitioner obtain? Is it A, a hemoglobin and hematocrit, B, a CMP, C, a uric acid level, or D, a calcitonin level? Take a moment to tell me what you got in the comments, you guys. All right, you guys, I always recommend reading the stem of the question first, so it allows you to slow down and ensure that you're answering what is even being asked of you. So here, the stem of the question states, what lab should the nurse practitioner obtain? All right, so we know we're looking for a lab to complete, but we need to run it back and see what we're like obtaining labs for. And typically we're using this as a diagnostic tool, right? So let's go back and see the assessment findings, see if they have provided us with a diagnosis or differential or anything of that nature, right? So the patient came in, complaints of pain to the left great toe. Nurse practitioner is thinking gout as a differential. So then you need to know what labs do we look at with gout. And when I'm telling you assessment, diagnosis, evaluation, and treatment, they may have that pain, they may have that swelling, commonly to those joints, but commonly to that great toe, the big toe, the first toe. Um, but when we want to confirm a diagnosis and diagnosis, those gold standards, we look at our C, our uric acid levels, right? Because high uric acid levels can confirm a diagnosis of gout, especially with the presentation. All right, so question number two. The nurse practitioner has confirmed the diagnosis of gout on this patient, so they must have had a high uric acid level, okay? What is the best treatment for this acute gout exacerbation? Is it A, allopurinol, B, allopurinol and NSAIDs, C, NSAIDs and colchicine, or D, NSAIDs and acetaminophen? Take a moment and tell me what you got in the comments. All right, you guys, so stem of the question states, what is the best treatment for this acute gout exacerbation? All right, so stem of the question gives you everything you need to know to answer this question. So the gout was confirmed, but the stem states, what is the best treatment for this acute gout exacerbation? So you need to think of gout treatments, but pay close attention to the acute term there. Again, STEM tells you everything. Best treatment, best being the absolute, one of those absolute terms. Acute telling you what type of treatment, and for gout. So allopurinol, no, you can eliminate that because that's more on a prophylactic level, right? Same with B. C is your best answer. When we are treating gout on an acute and exacerbation, you want to use like your NSAIDs and your colchicine to treat the pain. Now, y'all know my Britney's Brilliance that I say on my videos. If you see my gout review, I tell y'all, we need to cut it, right? That's my mnemonic for you. We need to cut it. Cut the pain now. You know the song, you need to cut it. So need for NSAIDs, N for NSAIDs, N for needs, and cut it, C for cut it, C for colchicine, right? So when we need to cut the pain now, we want to go NSAIDs and colchicine for acute flares, all right? And then lastly, question number 3 for today. The nurse practitioner is planning to prescribe the patient with prophylactic therapy in the future to reduce the frequency of gout flares. What is the best prophylactic treatment option? Is it A, allopurinol, B, NSAIDs and allopurinol, C, NSAIDs and colchicine, or D, NSAIDs and acetaminophen? Take a moment and tell me what you got in the comments. All right, you guys. So, stem of the question states, what is the best prophylactic treatment option? All right, so we're looking for a prophylactic treatment. Let's see, let's run it back and see if they provided us with a diagnosis so we know what treatment what are we trying to treat, right? And if they don't provide the diagnosis in the scenario, you want to run it back a step further and look at the assessment findings so that you can come up with your diagnosis, right? So here we're still talking about gout. The nurse practitioner is anticipating, for future treatment options, right? Planning ahead to prevent the frequency of gout flares. So with that, we want to provide prophylactic management. Okay, we do not provide prophylactic management while in an acute flare. But if they were already on prophylactic treatment, and then they have a flare, there's no need to stop that treatment, okay? So let's answer the question first and I'll explain that a little bit more. So, what is the best prophylactic treatment option for gout, right? And the answer is A, allopurinol. Brittany's brilliance, I say A, allopurinol has the word all in it because it covers you all the time. So, prophylactically, you want to have that all the time coverage and not just for the acute flare. So, with this, make sure, because often we know the medicines, but you're often being too quick with the question and just finding the treatment and selecting it and not paying attention to whether they're saying acute treatment or prophylactic treatment. So pay attention to those all the time. But what I was just explaining, so say you have a patient say this particular patient, this is a new finding, we just diagnosed them with gout, they're currently in an acute flare, we're giving you your NSAIDs and colchicine. You would not prescribe allopurinol right now because they're an acute flare. Now, when you bring them back and they're stabilized, you want to then prescribe the allopurinol so that they have prophylactic management to prevent those frequent flare ups in the future. Now, say you already have started this allopurinol for prophylactic management, and then they end up having an acute flare. You can prescribe NSAIDs and colchicine then to help reduce that pain during that flare up, and you don't need to stop the allopurinol because they're already on it. We just do not start or initiate it during an acute flare, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure y'all meet me back here. If you need any other resources that I offer, review book either in the ebook or paperback option, they are both linked in the bio of this channel. Self-paced independent review if you like to study on your own, test your knowledge, study on the go, short and sweet videos for family and adult Gero, preparing for AANP and ANCC. I have a review option like that with videos broken down by system. That's also linked in the bio of this channel. My 5-week review course, our next one is June the 10th. So y'all who have already registered, you'll see those emails for the link to start with that. Class is that's already closed for us to start. If you want to join, be on the lookout for the next ones coming up. And then also our one-on-one sessions that I offer, they're customized. So I always say reach out by phone or email so we can determine what you need, because it is either based on sessions for weaknesses that you just want to focus on, sessions for exam readiness assessment, or then you also have a custom plan that's more longer in duration based upon, for example, if you had an unsuccessful attempt and now you don't know how to get back to reviewing and what you should do differently to be successful, we look at your weaknesses. We gauge what you need to do from that standpoint. We design a study plan for you. We structure it and work alongside with you during that duration of the time to take you from unsuccessful to successful. So if you need any of those resources, just reach out to the nursing studio at 803 400 6864. You can also shoot a text message to that number or shoot us an email at the nursing studio, the number one at gmail.com. But as always, meet me back here. Happy studying. Bye, y'all.